Assalamualaikum warahmatullahi wabarakatuh. Morning guys, my name is Oki Alfiansyah. You can call me Oki. Name K1002000188. I'm from Major of Pharmacy in University of Muhammadiyah, Surakarta. I will to present about pharmacists. I'm sure there are many people who know about pharmacists. Pharmacists are not only people who make medicine, but there are many more facts about pharmacists. Let's see. First, I want to tell you about intent of pharmacists. Pharmacists, also known as chemists or druggists, are health professionals who specialize in medicine and their use as they deal with the composition effect, mechanism of action, and proper and effective use of drugs. Using knowledge of the mechanism of action of drug, the pharmacists understand how they should be used to achieve maximum benefit, minimal side effect, and to avoid drug interaction. Pharmacists undergo University of Graduate level education to understand the biochemical mechanism and action of drug use, therapeutic rules, side effect, potential drug interaction, and monitoring parameters. This is math to anatomy, psychology, and pathopsychology. Pharmacists interpret and communicate this specialist knowledge to patients, physicians, and other healthcare providers. Among other licensing requirements, different countries require pharmacists to hold either a Bachelor of Pharmacy, Master of Pharmacy, and Doctor of Pharmacy. Second, I want to tell you about nature of work of pharmacy. Historically, the fundamental role of pharmacists as a healthcare practitioner was to check and distribute drugs to doctors for medication that had been prescribed to patients. In more modern times, pharmacists advise patients and healthcare providers on the selection, dosages, interaction, and side effect of medication, and act as a learned intermediary between a prescriber and a patient. Pharmacists are often the first point of contact for patients with health inquiries. Thus, pharmacists have a significant role in assessing medication management in patients and in referring patients to physicians. This role might include, but are not limited to: 1. Clinical medication management, including reviewing and monitoring of medication regimens. 2. Assessment of patients with undiagnosed or diagnosed condition and ascertaining clinical medication management needs. 3. Specialist monitoring of disease states such as dosing drugs in kidney and liver failure. 4. Compounding medicine. 5. Providing pharmaceutical information. 6. Providing patients with health monitoring and advice, including advice and treatment of common ailments and disease states. 6. Supervising pharmacy technician and other staff. 7. Oversight of dispensing medicine on prescription. 8. Provision of and counseling about non-prescription or over-the-counter drugs. 9. Education and counseling for patients and other healthcare providers on optimal use of medicine. 10. Referrals to other health professionals if necessary. 11. Pharmacokinetics evaluation. 12. Promoting public health by administering immunization. 13. Constructing drug formularies. The last, I want to tell you about education and credentialing of pharmacy. The role of pharmacy education, pharmacist licensing and continuing education vary from country to country and between regions or localities within countries. In most countries, pharmacists must obtain a university degree at a pharmacy school or related institution and or satisfy other national or local credentialing requirement. Pharmacists are educated in pharmacology, pharmacognosy, chemistry, organic chemistry, biochemistry, microbiology, pharmacy practice, pharmaceutics, pharmacy law, pharmacokinetics, and pharmacodynamics and anatomy. Some may undergo further specialist training such as in cardiology or oncology. Specialties include academic pharmacy, clinical pharmacy specialist, community pharmacist, compounding pharmacist, consultant pharmacist, drug information pharmacist, home health pharmacist, hospital pharmacist, industrial pharmacist, informatic pharmacist, and managed care pharmacist. So, is the explanation about the pharmacist? If you any question, please.
Yes, sir. I have 3 questions. First, what is mean by jurisdiction? Second, what is mean by pharmacokinetics? And third, what is mean pharmacognosy? Thank you, sir.
To answer your question, first, what is meant by jurisdiction? Jurisdiction is the area where a law is enforced based on the law. So it means the scope of work of a pharmacist in accordance with applicable laws. 2. What is meant by pharmacokinetics? Pharmacokinetics is a branch of pharmacology dedicated to determine the fate of substance administered to a living organism. 3. What is mean pharmacognosy? Pharmacognosy is the study of plants or other natural source as a possible source of drugs. Enough?
Yes, sir. Thank you.
Thank you for your attention. Thanks for watching and stay healthy. Goodbye. Wassalamualaikum warahmatullahi wabarakatuh.